There's a food in your kitchen right now that millions of people eat believing it protects their heart. Yet in certain situations, it may quietly increase stroke risk. Doctors rarely talk about it. Food labels don't warn you. And most people never realize anything is wrong until the damage is already done. This isn't some rare, exotic ingredient. It's not hidden in processed foods or disguised under a chemical name. It's sitting in your fruit bowl. It's in your refrigerator. It might even be what you had for breakfast this morning. And before you think this is just another sensationalized health scare, let me be clear. This isn't about fear. It's about understanding how context changes risk. Because here's what most nutrition advice gets wrong. It treats every person the same, every body the same, every situation the same. But your body isn't a textbook. Your medications, your age, your kidney function, your metabolic health. These factors change everything. On BioVision, we're uncovering what science actually says and why this topic has become one of the most misunderstood areas of nutrition and brain health. Stay with me, because the truth is more complex and more surprising than you've been told. By the end of this video, you'll understand exactly which fruits require caution, why your doctor may never have mentioned this, and how to make informed decisions that actually protect your brain. Let's begin. Section 1. The hidden problem no one explains. When people think about strokes, they think about age, stress, or genetics. They imagine someone clutching their chest. They think of smoking, obesity, or a family history they can't control. What they rarely consider is how everyday foods interact with blood pressure, blood sugar, and medications. And that's a problem, because strokes don't announce themselves. In the United States alone, someone has a stroke every 40 seconds. Every 3.5 minutes, someone dies from one. These aren't just statistics. These are parents, partners, friends, people who often had no idea they were at risk. And here's what makes this so frustrating. Up to 80% of strokes are preventable. Not through expensive treatments, not through genetic modification, through lifestyle, including diet. But here's where the conversation falls apart. Most fruits are healthy. Research clearly supports that. Population studies consistently show that people who eat more fruits and vegetables have lower rates of cardiovascular disease, including stroke. But healthy does not mean universally harmless. A food that protects one person may destabilize another. A fruit that supports cardiovascular health in isolation may become problematic when combined with certain medications. In neurology, we see risk emerge when foods are consumed in excess. Juices replace whole fruits. Diet collides with medications. Underlying conditions change how nutrients are processed. That's where the controversy begins. And that's exactly what we need to talk about. Because the goal here isn't to make you afraid of fruit. The goal is to give you the information your doctor probably doesn't have time to explain, so you can make choices based on your specific situation. Let's start with a fruit that almost everyone considers harmless. Fruit number 5, bananas. Why moderation matters. Bananas are one of the most consumed fruits on the planet. They're convenient, affordable, naturally portioned, and available year-round in almost every grocery store in the world. Athletes eat them for quick energy. Parents pack them in school lunches. Health experts recommend them as a potassium-rich snack. And here's the thing, that advice isn't wrong. Bananas are often praised for their potassium, and rightly so. A single medium banana contains about 400 to 450 milligrams of potassium, roughly 9 to 10% of the daily recommended intake. Large studies show potassium helps lower blood pressure and reduce stroke risk in the general population. A 2014 meta-analysis published in the Journal of the American Heart Association found that higher potassium intake was associated with a 24% lower risk of stroke. 24%. That's significant. Potassium works by helping blood vessels relax, counteracting the effects of sodium and supporting proper muscle function, including the heart muscle. So where does concern come from? Why would any neurologist or cardiologist urge caution around something so apparently beneficial? The answer lies in a word most people never think about: balance. Your body doesn't just need potassium. It needs the right amount of potassium and the ability to regulate it. In healthy adults with normal kidney function, excess potassium is simply filtered out and excreted. The body maintains equilibrium. No problem. But in older adults, or people with kidney issues or individuals taking certain heart medications, potassium balance becomes fragile. Here's the mechanism. Your kidneys are responsible for filtering excess potassium from your blood. When kidney function declines, even modestly, this filtering becomes less efficient. Potassium begins to accumulate. At the same time, many common medications affect potassium levels. ACE inhibitors, used for blood pressure. ARBs, angiotensin receptor blockers. Potassium-sparing diuretics. Certain heart failure medications. These drugs can reduce potassium excretion or increase potassium retention, sometimes significantly. Now at a diet high in potassium-rich foods, bananas, potatoes, oranges, spinach, and levels can climb into dangerous territory. This condition is called hyperkalemia. Symptoms can include muscle weakness, fatigue, heart palpitations, abnormal heart rhythms. In severe cases, hyperkalemia can cause cardiac arrest. The stroke connection. But here's what's often missed in discussions about stroke specifically. Potassium imbalances don't just affect the heart directly. They affect vascular regulation. They affect blood pressure stability. They affect how blood flows to the brain. When heart rhythm becomes unstable, blood can pool and form clots. When blood pressure fluctuates unpredictably, vulnerable vessels in the brain face stress. This doesn't make bananas dangerous. It makes blind overconsumption dangerous in specific populations. For a healthy 35-year-old with normal kidney function and no medications, bananas are an excellent food choice. For a 72-year-old on multiple blood pressure medications with stage 3 kidney disease, the calculation changes. Health advice often comes in absolutes. Eat more potassium. Bananas are good for you, but medicine doesn't work in absolutes. Medicine works in context. The takeaway here isn't to avoid bananas. It's to understand your own situation. If you're over 60, if you take heart or blood pressure medications, if you've been told your kidney function is reduced, talk to your doctor about potassium. Ask what your levels are. Ask if your diet needs adjustment. Because the line between therapeutic and harmful is often just a matter of dose and circumstance. Fruit number 4, grapes. The sugar debate. Grapes are one of nature's most convenient snacks. Sweet, bite-sized, requiring no preparation. They're easy to eat mindlessly by the handful. And nutritionally, they have real benefits. Grapes contain antioxidants, particularly resveratrol, which has been studied for its potential cardiovascular benefits. They contain polyphenol that may support blood vessel function. They provide hydration, fiber, and essential vitamins. Red and purple grapes, in particular, have been associated with improved cholesterol profiles and reduced inflammation in some studies. So what's the concern? The concern centers on something grapes deliver very efficiently: sugar. A single cup of grapes contains approximately 23 grams of sugar. That's nearly 6 teaspoons. Now, in the context of a balanced diet, that's not necessarily problematic. The fiber in whole grapes slows sugar absorption. The water content dilutes the glycemic impact. But here's where behavior matters as much as biology. Grapes are easy to overeat. Unlike an apple or an orange, where you're consuming a discrete unit, grapes invite continuous snacking. A handful becomes a bowl. A bowl becomes half a bag. And suddenly, you've consumed 50, 60, 70 grams of sugar, often without realizing it. Why does that matter for stroke risk? Repeated blood sugar spikes inflame blood vessels over time, a known contributor to vascular disease and ischemic stroke risk. Here's the mechanism. When blood sugar rises rapidly, your body releases insulin to bring it back down. This is normal and healthy in moderation. But when this cycle repeats frequently, spike, crash, it creates metabolic stress. Over time, this leads to insulin resistance, chronic low-grade inflammation, damage to the endothelial cells lining your blood vessels, increased arterial stiffness, higher risk of atherosclerosis, Atherosclerosis, the buildup of plaques in arteries, is the primary driver of ischemic stroke, which accounts for approximately 87% of all strokes. The controversy: on one hand, whole grapes can be beneficial. They provide nutrients. They satisfy sweet cravings with real food rather than processed alternatives. Population studies generally show fruit consumption is protective. On the other hand, excessive intake, especially without fiber balance from other foods, may worsen metabolic instability in people already at risk. This is particularly relevant for people with prediabetes or type 2 diabetes, individuals with metabolic syndrome, those with a family history of cardiovascular disease, people already showing signs of insulin resistance. This is not about grapes causing strokes. It's about how metabolic stress accumulates silently over months and years until it manifests as measurable disease. Practical advice: enjoy grapes, but treat them as a food that deserves portion awareness. Pair them with protein or fat to slow sugar absorption. And if you're managing blood sugar issues, track how grapes affect your readings. Fruit number 3, oranges. When nutrition meets medication, oranges are one of the most trusted fruits in the world. For generations, they've been synonymous with vitamin C, immune support, and healthy eating. A glass of orange juice at breakfast feels virtuous. An orange in a lunchbox feels responsible. And in many ways, this reputation is deserved. Oranges are rich in vitamin C. A single medium orange provides over 100% of the daily recommended intake. They contain flavonoids that may support blood vessel function. They provide fiber, folate, and potassium. Population studies generally show citrus consumption is associated with reduced cardiovascular risk. So what could possibly be concerning about oranges? The answer lies not in the fruit itself, but in how it interacts with something millions of people use every day: medication. Few people are told this. Certain citrus compounds interfere with liver enzymes that process medications. The compounds in question are called furanocoumarins. Here's how they work. Your liver contains a family of enzymes called cytochrome P450. These enzymes are responsible for metabolizing, breaking down, a huge number of drugs. One particular enzyme, called CYP3A4, processes an estimated 50% of all medications on the market. Furanocoumarins inhibit this enzyme. When CYP3A4 is blocked, medications aren't broken down as efficiently. They stay in your bloodstream longer. Their concentration rises higher than intended. For some drugs, this means the effective dose you're receiving is much higher than what was prescribed. Now, grapefruit is the citrus fruit most famous for this interaction, and we'll discuss that next. But oranges, particularly Seville oranges, used in marmalades, and tangelos, a grapefruit-orange hybrid, contain similar compounds. Even regular sweet oranges contain some furanocoumarins, though in lower amounts. The blood pressure connection. For people taking blood pressure or cholesterol drugs, this interaction may cause medication levels to rise higher than intended, sometimes affecting blood pressure control. Consider this scenario. A patient is prescribed a calcium channel blocker, a common blood pressure medication. The dose is carefully calibrated to keep their blood pressure in a safe range. They have a glass of orange juice with breakfast. They don't think anything of it. But the citrus compounds inhibit the enzyme that metabolizes their medication. The drug accumulates. Their blood pressure drops lower than expected. In mild cases, they might feel dizzy or lightheaded. In more significant cases, blood pressure instability can stress the cardiovascular system, including the vessels that supply the brain. The fruit isn't toxic. The interaction is the concern. The insidious nature of these interactions. And here's what makes this particularly insidious. Interactions rarely come with warning symptoms. You don't feel the enzyme inhibition. You don't feel the medication accumulating. You just feel normal until you don't. This is why medication package inserts sometimes include warnings about citrus. But honestly, most people don't read those inserts. And most doctors don't have time to explain every potential food interaction. Practical advice. If you take regular medication, particularly for blood pressure, cholesterol, heart rhythm, or blood clotting. Ask your pharmacist about citrus interactions. Not just grapefruit. Ask about oranges, pomelos, tangelos, and citrus juices in general. It's a simple question that could prevent a complex problem. Fruit number 2, grapefruit, the least controversial risk. If there's one food-drug interaction that most healthcare providers agree on, it's this one. Grapefruit juice has one of the most documented food-drug interactions in medicine. This isn't speculation. This isn't preliminary research. This is established pharmacology taught in medical schools and pharmacy programs around the world. What makes grapefruit different? Here's what makes grapefruit different from other citrus fruits. It contains significantly higher concentrations of furanocoumarins, the compounds that inhibit the CYP3A4 enzyme we discussed earlier. The effect is so potent that a single glass of grapefruit juice can affect drug metabolism for up to 72 hours. Not hours, days. This means that even if you take your medication in the evening and had grapefruit juice at breakfast 3 days ago, there may still be an interaction. The extensive list of affected medications. The list of affected medications is extensive. Statins, cholesterol medications, calcium channel blockers, blood pressure medications, some antiarrhythmic drugs, certain blood thinners, some immunosuppressants, various psychiatric medications, certain cancer treatments. A study published in the Canadian Medical Association Journal identified over 85 drugs with clinically significant grapefruit interactions, and the number continues to grow as new medications enter the market. What this means for stroke risk. Grapefruit doesn't directly cause strokes. What grapefruit can do is change how medications behave in your body. If you're taking a blood pressure medication and grapefruit causes the drug level to rise unexpectedly, your blood pressure may drop too low or fluctuate unpredictably. Blood pressure instability is a known risk factor for both ischemic and hemorrhagic stroke. If you're taking a blood thinner and grapefruit amplifies its effect, you may be at increased risk of bleeding, including bleeding in the brain. The concern isn't the fruit in isolation. The concern is the fruit in the context of modern medicine. The gap between risk and awareness. Consider this. In the United States, approximately 66% of adults over 40 take at least one prescription medication. Among those over 65, the average is 4 or more. Many of these medications have known grapefruit interactions. Yet surveys suggest that fewer than half of patients are aware of these interactions. That's a significant gap between risk and awareness. The reason grapefruit is listed as least controversial isn't because it's the most dangerous fruit. It's because this interaction is so well documented that there's essentially no scientific debate. Practical advice. If you take regular medications, especially the categories mentioned above, you should either avoid grapefruit and grapefruit juice entirely, or consult with your pharmacist or doctor about whether your specific medications are affected. This is particularly important for juice. Whole grapefruit contains the same compounds, but is typically consumed in smaller quantities. Juice concentrates the exposure. If you love grapefruit and don't take any medications, enjoy it. It's a nutritious fruit. But if you're on prescription drugs, this is one area where a simple conversation with your healthcare provider can eliminate a real and entirely preventable risk. Fruit number 1, pomegranate. Marketing versus evidence. And now we arrive at the most complicated entry on this list. Not because pomegranate is dangerous, not because there's clear evidence of harm, but because this is where expectation and evidence diverge most dramatically. The superfood marketing. Pomegranate has been marketed aggressively over the past 2 decades as a superfood, a powerful protector of heart and brain health. The claims are bold. Supports cardiovascular function, rich in antioxidants, promotes healthy blood flow, protects against aging. And to be fair, pomegranate does contain impressive compounds, punicalagins and anthocyanins, antioxidants that have shown promise in laboratory studies, polyphenol that may reduce inflammation in cell cultures, compounds that have demonstrated effects on cholesterol oxidation in some research. The fruit has been used medicinally for thousands of years in various cultures. So what's the problem? The problem is the gap between marketing claims and clinical evidence, particularly when it comes to stroke prevention. When scientists examine stroke prevention specifically, the evidence is limited and inconsistent. There are promising mechanistic studies, research showing that pomegranate compounds can do interesting things in petri dishes or animal models. There are small human trials showing modest effects on blood pressure or arterial thickness. But large, long-term studies directly linking pomegranate consumption to reduced stroke incidence, those are largely absent. Showing that a compound affects cholesterol oxidation in a lab is interesting. Showing that eating a food reduces stroke rates in real populations is meaningful. These are not the same thing. What raises concern? What raises concern is not the fruit itself, but how it's often consumed. Concentrated juice. Pomegranate juice delivers high doses of both beneficial compounds and sugar. Many commercial pomegranate juices contain added sugars. Even 100% pomegranate juice is calorie-dense and easy to overconsume. High intake over long periods. When people believe something is a superfood, they sometimes consume in quantities that exceed any studied dose. Combining it with blood-thinning supplements, pomegranate has shown anti-platelet effects in some research. For people already taking blood thinners, aspirin, or supplements like fish oil, ginkgo, or vitamin E, there's theoretical concern about additive bleeding risk. What we know and don't know. There is no proof pomegranate prevents strokes. There's also no proof it causes them. The research is simply insufficient to make strong claims in either direction. And that uncertainty, not fear, is why neurologists urge moderation. Practical advice. Enjoy pomegranate as part of a varied diet. Don't rely on it as a stroke prevention strategy. Be skeptical of marketing that promises more than science can deliver. If you take blood thinners or anti-platelet medications, mention your pomegranate consumption to your doctor. And choose whole pomegranate seeds over juice when possible. You'll get fiber, controlled portions, and fewer calories. Juice versus whole fruit. We've discussed 5 specific fruits, each with their own nuances. But there's one pattern that emerged repeatedly, and it deserves its own discussion. Juice. One area where research is becoming increasingly consistent. Fruit juices, especially with added sugars, are associated with higher stroke risk, particularly hemorrhagic stroke. A 2019 study published in JAMA Network Open analyzed data from over 13,000 adults and found that each additional 12-ounce serving of fruit juice per day was associated with a 24% higher risk of all-cause mortality. Another study in the British Medical Journal found that while whole fruit consumption was associated with lower type 2 diabetes risk, fruit juice consumption was associated with higher risk. Why would the same fruit behave so differently? The answer lies in what juice removes and what it concentrates. What juice removes? Fiber. Fiber slows the absorption of sugar into your bloodstream. It promotes satiety, helping you feel full. It feeds beneficial gut bacteria. It provides physical bulk that limits how much you consume. When you eat an orange, you consume the sugar along with the fiber. The sugar is released gradually. Your blood sugar rises modestly and falls slowly. When you drink orange juice, you consume the sugar without the fiber. The sugar hits your bloodstream rapidly. Your blood sugar spikes, then crashes. What juice concentrates? Sugar and calories. A single orange contains about 12 grams of sugar. A glass of orange juice contains the sugar from 3 to 4 oranges, approximately 36 to 48 grams. You would rarely sit down and eat 4 oranges. You might easily drink that amount of juice with breakfast without thinking about it. The stroke connection. Hemorrhagic stroke, stroke caused by bleeding in the brain, has been linked in some studies to high sugar intake. The proposed mechanism involves chronic inflammation from repeated blood sugar spikes, damage to blood vessel walls, increased fragility of small vessels in the brain, elevated blood pressure from metabolic dysfunction. Removing fiber changes how fruit behaves in the body. This is where many people unknowingly cross from benefit into risk. Practical advice. Eat your fruit. Don't drink it. If you do drink juice, treat it as an occasional treat rather than a daily staple. Dilute it with water. Limit portions. Read labels for added sugars. And recognize that 100% fruit juice is not the health food that marketing has made it seem. Fruits with strong protective evidence. We've spent considerable time discussing concerns. Now let's talk about what the research actually supports. Because the goal here isn't to make you afraid of fruit. The goal is to help you make informed choices. Some fruits repeatedly appear in studies associated with lower stroke risk. Blueberries. Blueberries are among the most studied fruits for brain health, and the evidence is encouraging. They're rich in anthocyanins, the compounds that give them their deep blue color. These anthocyanins have been shown to cross the blood-brain barrier, accumulate in brain regions involved in memory and cognition, support blood vessel function, reduce inflammation. A 2019 study in the American Journal of Clinical Nutrition found that consuming the equivalent of 1 cup of blueberries daily improved vascular function and reduced blood pressure in healthy adults. Strawberries. Strawberries provide similar anthocyanin benefits in a more affordable package. Research published in the Annals of Neurology found that women who consumed the most strawberries and blueberries had delayed cognitive aging by up to 2.5 years compared to those who consumed the least. Apples. A 2020 meta-analysis in Critical Reviews in Food Science and Nutrition found that higher apple consumption was associated with reduced risk of cardiovascular disease, including stroke. Apples provide soluble fiber, pectin, polyphenol, and a satisfying crunch that promotes mindful eating. Avocados. Though technically a fruit, avocados behave differently than traditional sweet fruits. They're rich in monounsaturated fats, the same heart-healthy fats found in olive oil. They provide potassium without the sugar load of bananas. They contain fiber and various protective compounds. Research suggests avocados may improve cholesterol profiles and support healthy blood pressure. The key message: no single food will prevent a stroke. No single serving will protect your brain. What protects you is the accumulation of good choices over months, years, and decades. A blueberry today doesn't prevent a stroke tomorrow, but a pattern of choosing whole fruits over processed snacks, managing blood sugar over time, and maintaining vascular health through diet. That adds up. Who should pay closest attention? Throughout this video, we've talked about context. Let's be specific about who needs to pay closest attention. People over 60. Kidney function naturally declines with age. Medication use increases. Metabolic flexibility decreases. The margin for error narrows. People taking prescription medications. If you take medications for blood pressure, heart rhythm, cholesterol, or blood clotting, food-drug interactions are a real consideration. Ask your pharmacist. People with kidney disease. If you have reduced kidney function, potassium management matters. High potassium fruits may need to be limited. People with diabetes or pre-diabetes. Blood sugar management is central to both diabetes control and stroke prevention. Higher sugar fruits require more careful consideration. People on blood thinners. Some fruits have mild antiplatelet effects. Mention consumption patterns to your doctor. People with history of stroke or TIA. If you've already had a stroke, you're at significantly elevated risk for another one. Diet is a specific intervention to prevent recurrence. Practical takeaways. Let's translate everything we've discussed into actionable advice. 1. Eat whole fruits, not juice. This is the single most impactful change for most people. Juice removes fiber, concentrates sugar, and encourages overconsumption. 2. Variety matters. No single fruit is magical. No single fruit is dangerous. Rotate through different fruits throughout the week. 3. Know your medications. If you take prescription drugs, spend 5 minutes learning about food interactions. Ask your pharmacist. 4. Know your numbers. If you don't know your kidney function, blood sugar, and blood pressure, find out. These numbers determine how dietary advice applies to you. 5. Moderation isn't boring. It's strategic. The dose makes the poison. And the cure. Common sense, applied consistently, is more powerful than any superfood. 6. Be skeptical of extreme claims. Any headline that says a fruit prevents stroke or causes stroke is oversimplifying. Context matters. 7. Focus on patterns, not moments. What matters is what you do most of the time over long periods. Build sustainable habits. The final truth. Let's bring this together. No fruit is stroke trigger on its own, and no fruit is a cure. The headlines that scream, "This fruit causes strokes," are wrong. The marketing that promises this superfood prevents strokes is also wrong. The truth is more nuanced and more empowering. Risk builds when diet, metabolism, and medication collide quietly over time. It builds when people eat without awareness of their own health context, when medications are taken without understanding interactions, when sugar accumulates in the bloodstream day after day, when fiber disappears from diets. The most dangerous mistake isn't eating fruit. It's assuming context doesn't matter. But here's the empowering part. You can learn your context. You can ask about your medications. You can choose whole fruits over juice. You can pay attention to patterns rather than panicking. About individual foods. This is what evidence-based thinking looks like. Not fear, not blind trust. Understanding. And that understanding puts you in control. Closing and call to action. If this video changed how you think about food and brain health, I want to hear from you. Drop a comment below. Did any of this surprise you? Have you experienced medication-food interactions? What questions do you still have? If you found value here, share this video with someone who takes medication regularly, especially someone over 60. This information could be genuinely useful for them. And if you're new to BioVision, welcome. This channel exists because health deserves better than clickbait and fear. We dig into the research. We explain the nuance. We respect your intelligence. Subscribe if you want more content like this. Hit the notification bell so you don't miss future videos. On BioVision, we replace headlines with understanding. Until next time, take care of your brain. It's the only one you've got.